A warm and graceful evening to all the participating veterinarians. It is my privilege and honor to welcome today's guest speaker, Dr.S.Sivaraman sir, and Mr. P. Karunanidhi, Senior Vice President, Alembic Pharmaceuticals Ltd, for today's webinar. It is also my honor to welcome all the participating veterinarians for today's webinar. Before we start with the speaker introduction, from Alembic Pharmaceuticals, we wanted to say a few words regarding the veterinary profession. The word veterinarian resembles to us as a charismatic reader, dynamic and multidimensional person. We at Alembic Pharmaceuticals Ltd always care for veterinarians. Veterinarian is a key person to boost rural economy by providing health, production and reproduction of the animal. We all are aware, veterinarian used to do various activities on day-to-day basis like clinical examination, interacting with the dairy farmers, poultry farmers, piggeries, as well as pet parenting. Also diagnosis of the animal, treating the animal, prescribing the medicine, performing surgery at the lab, college or operation theater, or maybe at the field condition, vaccination, research, and providing healthcare recommendation, also creating awareness in healthcare. We at Alembic Pharmaceuticals Ltd salute the tiredness effort taken by the veterinarian in India and across the globe. Today and every day, we recognize the hard work, dedication, and passion that veterinary doctor provide. Because of that, our heart continue to fill with love. For that, we say thank you all the veterinarians. Wish you all happy World Veterinary Day in advance. Now I will request Mr. P. Karunanidhi sir, who is Senior Vice President and Cluster Head for the Animal Health Division, to introduce our today's eminent speaker.
Thank you, Santosh. Good evening to all the veterinarians who are participating in this program, and our also honored speaker, Dr.S.Sivaraman. With a lot of persuasion, we could get his time for making this presentation today. And as Dr. Santosh was explaining, that veterinarian is one of the noble profession. We are a pharma company, and our pharma company is also having a veterinary division. So many of the times we get chance to interact with other pharma colleagues, the people who are marketing human medicines. So their customers are human doctors like MPBS, MD, MS kind of doctors. So our customer profile is veterinary doctors. So we always say that your doctors can choose based on the emotion, but our doctors have to choose the medicine or treatment based on the emotion, also economy of the farmer. So being a veterinarian is a very difficult job. And I am sure all the veterinarians who are participating, you are always striving to give the best to the farmer and the improvement of the rural economy. Therefore, at Alembic, we feel great and honored to be a part of this program. Just 2 days before this World Veterinary Day, and this World Veterinary Day gives a memorable experience for all the veterinarians to feel proud about their profession. So at this moment, I would like to introduce our honored speaker today, Dr.S.Sivaraman. He is an assistant professor in Veterinary Clinical Complex, Department of Clinics, Veterinary College and Research Institute, Namakkal. He is energetic, is an excellent clinician, and always eager to treat animals and also teach his student. Dr. Sivaraman completed his B.V.Sc in 95 and M.V.Sc in clinical medicine in 97 from the College of Veterinary and Animal Science, Manuti, Kerala. So he also has done PhD in recumbent cows. So far his professional journey, he joined in Kerala government in Animal Husbandry Department as a veterinary surgeon. He worked there for 11 years as a field veterinarian in government, and then he joined as an assistant professor, Veterinary College and Research Institute, Namakkal, on 2010 until today he is continuing there. And during this tenure, I am sure that he had so many students, who would like to follow his path in treating the animal. I have come across many veterinarians who are working currently in the department and various sectors. They recall Dr.S.Sivaraman and their college days. So Dr. Sivaraman is specialized in large animal ultrasonography and ultrasound of udder and teat. And he is also specialized in large animal internal medicine as well as small ruminant internal medicine. And he introduced and also emphasizes always finding a simple procedural techniques in treating the complicated cases. He is interested in implementing field-oriented technology transfer in related to diagnostic aids like hand microscope in the field level, and also easy method and awareness for blood transfusion in large animals. And he also has designed a sling for the downer cows. And in many conditions, he has simplified and standardized the treatment protocol of toxicological cases in field level. And if you want to tell me, I can say many such finds like this. Because of time constraint, I am stopping at this level. And Dr. Sivaraman has been awarded and recognized at various levels a best veterinary, Model Veterinary Hospital Award when he was working in Kerala, and he is a best veterinarian award he received. And so far, he has published 65 national and international articles. And he is a member in various associations. He is a founder member. He is a founder member of LAVA, Large Animal Veterinarian Association of Tamil Nadu, which forms large animal practitioners for continuous education and update of professional knowledge in large animal practice. And he is a founder member of Association of Veterinary Dermatology, and he is a joint secretary in the same organization, that is Veterinary Dermatology. So thank you very much. I take pleasure in hand over this session to Dr. Sivaraman so that he can share his excellent knowledge with the field veterinarians for their benefit. Once again, a World Veterinary Day wishes in advance for all the veterinarians who are participating in today's program. Thank you very much.
So good evening to everyone. My dear students, dear practicing veterinarians who are attending this webinar from various parts of India and abroad. I welcome you all to this session on clinical perspectives on ruminal acidosis. So here many of our students are attending this webinar, and many of the practicing veterinarians, those who are recently graduated and started their practice, they are also attending this webinar. So experienced veterinarians, you might have a lot of experience regarding attending many number of acidosis cases. So I just ask you all to just refresh everything and keep it as a fresh, as if you are attending a freshly the ruminal acidosis case. Because there are a lot of things in ruminal acidosis we have to learn, and we have to update regarding the acidosis. Because acidosis is a basic case. It's a very basic, very basic case of a veterinarian. When a case is presented to a veterinarian, he has to identify whether the animal is having acidosis or not. That is the first clinical case he has to come to your confidence. If the animal is presented to you, you should 100%, not 99%, 100% you should say this animal is having acidosis or not. Then only we can switch over to the other cases very easily. It's very easy to diagnose the acidosis case. Once you diagnose the acidosis case, you can switch over to, if it is not acidosis, you can easily switch over to any other clinical differential diagnosis very easily. That's why I'm telling to our students and practicing veterinarians, we have to be thorough in diagnosing the acidosis case and also in treating the diagnosis case, I mean acidosis, and also in telling the prognosis about the case. Not only treating, we have to tell the prognosis. By presenting the case, we have to assess the prognosis. That's why this session will be very much useful for you in dealing all these cases. I mean, acidosis is a very basic one. Why I have selected this acidosis? Because we have to come about a comprehensive knowledge about acidosis. We can talk about acidosis in 5 to 10 minutes. We can teach in 5 minutes, or we can even teach in 50 minutes. We can teach in even 5 hours. That much rich information is in case of acidosis. But here in our session, I am not going to deal about the complete theoretical aspect, only the practical aspect and also the clinical management of acidosis. And since many of our students are interested in attending this webinar and practicing veterinarians, pathogenesis alone will be some part of theoretical basis, because once you know about the strong theoretical knowledge of acidosis, you can very easily correlate the clinical science and other things very easily. So whenever a case is presented to you in a hospital or whenever you are attending a case, the basic things we have to note down the clinical examination is we have to see the temperature, whether the animal is having temperature is or not. Then only we can able to differentiate the diagnosis. If the animal is having temperature, then you will be thinking about blood protozoan disease. If there is any steep rise in temperature, you will be thinking about viral origin. Like the temperature will give a lot of information. If there is a subnormal temperature, you see whether there is any septicemia or anemia is there or not. When the animal is recommended, the animal is having subnormal temperature, we think about milk fever. So temperature is very, very important. And you see the heart rate gives a prognostic indicator in many number of cases. We have to see the heart rate in all the animals. Whenever you are not able to come to a conclusion in a diagnosis of any cases, you have to see the heart rate. Then it will give you a clue about the case. Then you have to see the mucous membrane, conjunctival mucous membrane. So why I am telling all these things before acidosis, the comprehensive clinical examination is very, very important. That's why I am giving a short introduction regarding the clinical examination. I mean the physical examination. Mucous membrane, you have to see the mucous membrane. What about the color of the mucous membrane? Whether it is pale in nature or pale pink in nature or pink and moist, or whether it is congested, so that you can easily differentiate your diagnosis. And see the rumen motility. You have to come to the left side of the animal and the paralumbar fossa, left paralumbar fossa. You palpate the left paralumbar fossa and see the rumen motility, how much per minute or how much per 5 minutes is coming. Whether there is motility is there or not. There is hypermotility is there or not. There is no motility. So that we can easily come to a conclusion of the diagnosis. And see the rumen consistency, whether it is hard in nature or soft in nature. If it is hard and firm in nature, you think about rumen impaction at all. Okay. Then if the animal is having salivation, profuse salivation, you see the oral cavity examination. Just maybe a simple case of oral ulcers, FMD may be there. So oral cavity examination should be done, and it will be a very much important thing in your clinical practice. And the rectal examination, another thing, the same thing. Whenever doing the rectal examination, see the quantity of the dung, how much quantity of the dung is coming. What about the consistency of the dung, whether it is a semi-solid nature or pellety in nature or complete absence of the dung, so that it will give you a clue for all these things. Then see the abdominal shape of the animal. If the animal is presented to you, just stand behind the animal from the rear view, just behind the tail, stand behind the tail and just see the abdominal shape, so that it will be very much giving a clue for your diagnosis. And in all the cases, you just see the venous stasis, whether it is showing positive or not. If it is showing positive venous stasis, then it's a case of traumatic pericarditis. So these are the basic things we have to see in the clinical examination of the animal. So we have to develop the art of clinical examination. And also you have to assess whether the animal is having dehydration is there or not. So look at the muscle. If the muscle is dry, it indicates the dehydration. If the muscle is moist, it indicates there is no dehydration. You just see whether the animal is dehydration is there or not. Some animals will be presented with a dry muscle. Okay. So you can easily identify. Then you can use the skin tinting test, and the sunken eyeballs will be there. The sunken eyeballs indicate you have severe dehydration. And you can ask the history about the urine output, whether the animal has passed urine or not. And if you are having the laboratory facilities, you can see the PCV, packed cell volume. The packed cell volume, if it is increased, that indicates dehydration. If the packed cell volume is decreased, that indicates anemia. Simply, you can very easily diagnose by means of this type of clinical examination, and also a simple procedures of complete blood count. Here, we are going to see about the ruminal acidosis, the pathogenesis of ruminal acidosis, clinical signs of ruminal acidosis, how we are going to diagnose the ruminal acidosis, and what are all the treatment schedule, how to treat the cases. Simply, if I am telling the case of treatment, sodium bicarbonate in normal saline, it may not be sufficient for the practicing veterinarians. You have to stage by stage classify what are all the cases of acidosis. Subacute acidosis means how you have to treat it. Acute acidosis, how you have to treat it. Per acute case, how you have to treat it. Like that, you have to classify the acidosis separately. And some of the complicated cases you would have seen, but you would have not recognized that type of cases. You could have attended acidosis case with successfully some of the cases. Some of the cases you would have failed in treating the acidosis case. So in such a cases, you have to know what are all the complicated cases, why we have failed in such a condition. There you have to see some of the complicated cases. Sometimes sodium, the acidosis will be complicated with hypokalemia. Acidosis will be complicated with hypocalcemia. Acidosis sequelae leads to polyencephalomalacia. Acidosis dehydration may be there. We would have not given that fluid therapy, so we would have failed in that case. So there are a lot of things we have to keep it in mind in treating acidosis. Once you attend this session till the last thing, the treatment schedule, you will get a good comprehensive knowledge regarding the treatment of acidosis. So here we used to talk about acidosis means automatically the concurrent one, the acidosis, the related one is a SARA, subacute ruminal acidosis. It will come into the mind directly. So we have to first see about what is SARA, subacute ruminal acidosis. That is transient decrease in the rumen pH. Because acidosis means, I will explain in detail. So subacute ruminal acidosis, when there is any carbohydrate engorgement, not to abnormal levels, but when compared to the roughages, concentrate is increased. The consumption of concentrate is increased, so that the transit with temporary reduction in the rumen pH, and there will be increase in the due to the increase in the concentrate feeding and reduced availability of the roughages. All these are the causes of subacute ruminal acidosis. So in such a cases, there will be frequent fluctuation of the rumen pH towards the acidic media in a day. So for example, the subacute ruminal acidosis is most commonly defined as a repeatedly occurring prolonged period of depression in the rumen pH. That is important. In a day, for about 24 hours in a day means a prolonged period. When there is any drop of rumen pH below 5.5, and that will be persisting for a prolonged period for 2 hours, 3 hours, or 5 hours, 6 hours, like that, because of the non-availability of the roughages and higher grain feeding. So these type of things will lead to the change of rumen pH towards acidic media, and it will be persisting for more hours. That is causes subacute ruminal acidosis. There is excessive accumulation of volatile fatty acid without persistent lactic acid accumulation. So here we cannot see, suppose when you see the animal, you cannot see just by clinical science, you cannot come to a conclusion is SARA. But after experience, by seeing certain clinical signs, you can able to identify this animal is having SARA, subacute ruminal acidosis. The first and the foremost thing is the reduction in the milk yield and the reduction in the milk fat percentage. That is important. Reduction in the milk fat percentage means first you think about subacute ruminal acidosis. For example, you are attending a farm practice. You are attending a very big farm. Some 100 animals are there. The owner is telling there is abrupt reduction in the milk yield, sudden reduction in the milk yield. First differential diagnosis is leptospira, outbreak of leptospira. So you have to think about any outbreak of leptospira is there or not in that farm. Like that, if there is any sudden reduction in the milk fat percentage, you have to think about the two things. One thing is the subacute ruminal acidosis, and another thing is the availability of the fodder, roughages. Lack of roughage to that animals on the farm will lead to the reduction in the milk fat percentage. How? There will be reduced availability of the production of acetic acid. Acetic acid is the precursor of milk fat. So reduction in the acetic acid, naturally the milk fat will be reduced. One. And the animal will be having suspended rumination. What is rumination? The animal will be, during the rest time, it will be chewing. After it will take the cut from the rumen and it will go on chew it during the rest time. So suspended rumination means that we reduce the rumination, reduce the time. Most of the animals, they will spend more time on rumination. That is a good sign. When limited time of rumination is there, then it's a indicative of lack of roughages. That will be also a sign of SARA. Then when you see the dung, it's a classical thing. The semi-solid or loose dung with the bubbles is a classical finding of subacute ruminal acidosis. And many animals in the farm, you could have seen hoof abnormalities. Many of the animals will be having long eruptions of the hoof and overgrown of the hoof, fissures in the hoof, like that. Hoof abnormalities will be there. Laminitis will be there. Many of the animals, there will be switching of the tail frequently will be noticed. And smudging of the perineum with the dung. All the perineum is the hindquarters will be smudged with the dung material always. undigested feed material will be present in the tongue, fiber material will be present in the tongue. These are all the classical signs of subacute ruminal acidosis. For example, fiber material in the tongue, how will you identify the fiber material? Pretty simple in the practice. Just you can take the tea sieve that we are using for preparation of the tea, that sieve, that mesh-like thing. Like that, you take a sieve and put a small quantity of the dung and wash it, and the water will, everything will be go away. And you can see the remaining particles, fiber material. If more number of fiber material is present in the dung, that is indicative of SARA, subacute ruminal acidosis. Very easily you can diagnose in the field practice. In our dispensary itself, we can use. Just that needs just sieve of tea sieve. A small mesh-like thing is there, that you can be able to identify the fiber materials in the tongue. Or even you can identify the sand materials in the tongue also by this method. So this picture you can see here. This is a village. It's a village road. So in the village, each and every house opposite, the outside the house, they'll be keeping a small pit-like thing, and they'll pour all the waste of the kitchen waste, like rice gruel, rice, chapati, idli, dosa, and all other things will be. They will put it under with the water and everything will be there. Those animals which are passing through the village road, they will consume this type of things, this rice gruel like fluid, and they will go for grazing. So this indicates why I put this. This is a common practice in the village and the household also. It's a common practice. They used to give rice and all the kitchen waste back to the animal, and they will be thinking, when you ask the history whether you have fed with the rice or not, they will say no, we have not given any rice. But unknowingly, they will be giving some rice or gruel, rice gruel, or chapati or idli, dosa like that to the animals as a kitchen waste, and they will be feeding with the water. And those animals which are getting a huge amount, when you are drinking this in a large quantity, they will be predisposed for SARA, subacute ruminal acidosis, or when it consumes more quantity, that will lead to acidosis. So this type of practice is commonly noticed in the villages. You can come across in villages, and also in household also. They used to keep this type of pit for animals, and this is one of the cause of acidosis and subacute ruminal acidosis. In such a cases, the milk fat percentage will be very much reduced. You cannot even expect a milk fat percentage. And see here the quantity, the consistency of the dung is a semi-solid in nature. Semi-solid in nature with the small bubbles are noticed. Even you can identify watery semi-solid diarrhea with small bubbles is indicative of subacute ruminal acidosis. So the animal will be feeding everything normal, watering everything normal, but the animal will be passing on loose dung. So that is SARA, subacute ruminal acidosis. Here in this picture, you can able to see the small undigested grain materials. Undigested grain materials in the dung. That is also the indicative of SARA, subacute ruminal acidosis. So here you can able to see the hoof abnormalities. Here you can able to see the fissures in the hoof, overgrown hoof, and hoof abnormalities will be there. All these things are clear indicative of SARA, subacute ruminal acidosis. So there is no treatment. You cannot say it as a treatment of SARA. That is a management of SARA. Management means management of subacute ruminal acidosis by feeding management. Balanced grain to fiber feeding. That you have to take care. You should not give more concentrates. And if there is a lack of roughages, you supplement roughages. The animal should inclusion of long fiber particles to promote salivation as a buffer. Once the animal started chewing, the animal will start secreting. The salivation will be there, and the salivation acts as a buffer mechanism for the rumen, and it works well for ruminal acidosis. I mean SARA. And it is not maintaining properly, you can go for supplementation of oral buffer supplements. Many oral buffer supplements like Rumibuff, everything is that. I mean magnesium oxide, magnesium carbonate, all these things are available that you can use it orally for this type of cases. I will tell you. Any antacids can be given for this, and with the probiotics, any probiotic bolus you can supplement. And in ruminal acidosis, that's what we have seen is the subacute ruminal acidosis. Subacute ruminal acidosis. Here, when coming to the ruminal acidosis, the synonyms of ruminal acidosis are acute carbohydrate engorgement in ruminants, grain overload, ruminal lactic acidosis, ruminal acidosis, rumen overload. All these things are the synonyms of ruminal acidosis. Anything you can say. Or generally we used to say as acidosis or ruminal acidosis. Like that we used to call. This you have to see the difference in the just to go through the wordings. Sudden ingestion of large quantity of carbohydrate. I mean sudden ingestion of toxic doses of carbohydrate rich feed in like grains. Okay. So when you ask the farmer whether you have fed with any concentrate or not, they will say no, we have not given any concentrates or like that. They will say. Otherwise, some of the farmers, they used to say, we are giving for a long period, or we are giving for years and all. Sir, you are coming and telling me now you should not give rice and all, or cooked rice or boiled rice or whatever the thing, you should not give like that. They used to say. The sudden ingestion of large quantity, the quantity only. So just giving a small quantity of rice, a small quantity of wheat, a small quantity of cooked rice, it won't cause ruminal acidosis. Just you think in mind. Consumption of large amount of carbohydrate, say, that will causes ruminal acidosis. That is the difference. So what is the etiology? Well, factors which causes ruminal acidosis. Rice, including cooked rice, unboiled rice, the rice we are getting from the ration shop, the people used to give to the animals, and rice which are, they used to keep the rice in the paddy field after getting the rice from the shop or anything from the field. They used to store it in the home. So the goat and the sheep and goat, when they are rearing the home, they will suddenly go and easily get access to that rice, and they will eat large quantity. That will lead to ruminal acidosis. And other things, the wheat, finely ground material, grains, flour, brewer's yeast, tapioca, finely grounded flour, any type of flour, easily digestible flour, and grains, sugar beet, bread, apple, grapes, banana, all the kitchen waste, everything, all these things will lead to acidosis. I mean, any kitchen waste, all the idli, dosa, paratha, rice, cooked rice, boiled rice, anything, when they have consumed in the large quantity. In sometimes recently cowed animals in villages and all, the farmers, they used to feed large quantity of flour items. They used to mix the finely grounded flour items and mix it in water, and they will boil it, and after that they will used to give the animal for giving more milk. So for giving more milk, that will give more propionic acid. For that they will used to give. But suddenly the rumen cannot adapt to that huge quantity of concentrates. So what will happen? Definitely the animal will go for ruminal acidosis. So these are all the etiological factors. You have to keep it in mind for the cause of, the acidosis. So regarding acidosis, there are various forms. You can term it as mild, moderate, severe, and subacute ruminal acidosis. We have already seen about subacute ruminal acidosis. The other things are mild, moderate, severe. You need not treat it all the animals as the same thing of acidosis. You have to identify whether the acidosis is a mild form, moderate form, or severe form. That we'll see in this class. So first we'll see about the pathogenesis, how acidosis occurs. Then you can easily correlate to the clinical sense. Once you understand the pathogenesis very easily, you can easily correlate with the clinical science. Easily you can correlate, I am telling. Just the animal, you just assume that the animal has consumed carbohydrate, large quantity of carbohydrate. Animal has consumed large quantity of the carbohydrate is ingested. So the carbohydrate is present in the rumen, and it's what will happen once the carbohydrate is ingested and it comes into the rumen, there will be proliferation of S. bovis, Streptococcus bovis bacteria. They will proliferate. Once carbohydrate is ingested in the rumen and it is present in the rumen, within 2 to 6 hours, there will be multiplication of Streptococcus bovis, that is a gram-positive bacteria in large quantity, and what they'll go on start utilizing this carbohydrate. This S. bovis will start utilizing this carbohydrate. During this utilization process, they release a byproduct that is called a lactic acid. They produce lactic acid as a byproduct. So there is lactic acid accumulation in the rumen. So since the lactic acid is accumulated in the rumen, what will happen? There will be reduction in the rumen pH. Naturally, there will be reduction in the rumen pH below 5.5, and there will be histamine release will be there. Because of the histamine release, there will be causes of laminitis in the animal. So what will happen? The increase in the volatile fatty acids. So there will be increase in the lactic acid already is there. Increase in the concentration of the volatile fatty acids is there. So the low ruminal pH allows the lactobacillus to grow in the rumen, and also further the utilization of the carbohydrate will lead to produce about more lactic acid. You think about more lactic acid, that is the 2 forms, D form and the L form of lactic acid is produced. And here the increase in the rumen osmolality. Since the accumulation of lactic acid and volatile fatty acid concentration is more in the rumen, there is the increase in the rumen osmolality, and it will draw what will happen. Since there is increase in osmolality in the rumen, it draws fluid from the systemic circulation. So it draws systemic fluids from the systemic circulation to the rumen, and hence the animal gets dehydrated. That's why we are getting sunken eyeballs and dehydration in the animals. So the animal get dehydrated, and that's why you are getting the heat dehydration, and you are palpating the rumen. The fluid splashing sound is coming because of this pathogenesis. The animal that because of increased rumen osmolality draws fluid from the systemic circulation to the rumen, and that causes the fluid splashing sound in the rumen. That is very easy diagnostic feature for identifying the acidosis case. And here the lactic acid is 10 times more stronger than the volatile fatty acid. And because of reduced rumen pH, the rumen atony is nil. There is no rumen motility won't be there in case of ruminal acidosis. The rumen motility will be nil, and lactic acid is absorbed into the systemic circulation, and the L-lactic acid is rapidly metabolized, and D-lactic acid is slowly metabolized. There are two forms I told you. L-lactic acid is rapidly metabolized. D-lactic acid is slowly metabolized, and that will cause lactic acidosis. D-lactic acidosis are chemical, the ruminal acidosis. And this lactic acid frequently it will be there in the rumen. It will cause us bacterial ruminitis or chemical ruminitis. That we will be telling in the last session of this webinar. What are all the causes of this complications of this bacterial ruminitis? Because of this bacterial ruminitis, some other conditions will be there in the clinical cases. It may go unnoticed during our clinical practice. So this low pH will favor the growth of mucor and rhizobus like things will be growing in that rumen media. So just now I have explained about the acidosis case. You just think it and keep it as a refreshment. Just rewind it. The animal is consuming grain, large amount or large quantity of the grain, huge quantity of the grain. The carbohydrate is ingested and it comes into the rumen. The carbohydrate, once the carbohydrate reaches the rumen, the proliferation of S. bovis will be there, gram-positive organisms, Streptococcus bovis will proliferate. They will start utilizing this carbohydrate, and the end product release is the lactic acid. Once lactic acid is produced, there is a drop in the rumen pH. So normal rumen pH is 6.7. Normal rumen pH is 6.7. So here accumulation of lactic acid will lead to the reduction in the rumen pH. So reduction in the rumen pH, that will also favors the organism further. The lactobacillus organism, they will proliferate and develop, and they will also produce more lactic acid, and lower lactic acid will accumulation will lead to increase in the osmolality in the rumen. So they will draw fluid into the rumen. So the animal will get dehydrated. Rumen contains more amount of water, and there will be fluid splashing sound. And these fluids will come out as a diarrhea in about 6 to 8 hours. That is the pathogenesis. Here, the diarrhea occurs only after 6 to 8 hours. For example, the animal is consumed concentrate now by about 6 o'clock, means by 7 o'clock it won't have any diarrhea. So in such a conditions will be a clinical signs. If the animal is presented with a clinical signs, you have to keep it in mind. So many of the veterinarians, they used to say diarrhea is not there, but the animal has consumed the carbohydrate, but the animal has not shown any clinical signs because only 1 hour has passed. The animal will be starting the clinical signs. So even if without diarrhea, by history also, you can start the treatment for the acidosis. So diarrhea will occur only after 6 to 8 hours of it. So once you understand the pathogenesis, you can keep it in mind all about the clinical signs. You yourself correlate the clinical signs, and you can come to what are all the clinical signs, possible clinical signs. So if within few hours there is no obvious clinical sign. The animal, the owner is telling the animal has consumed carbohydrate by now, and we have brought it immediately, means you put the stomach tube and evacuate the rumen content, give some fluid therapy and give antacids, the animal will be okay, normal, it will become normal. Once the animal has developed into the lactic acid, the lactic acid is absorbed into the systemic circulation. Then once it developed the systemic involvement, then only you need to go for sodium bicarbonate IV, otherwise there is no need. So in such a cases, when it is presented immediately, you can give oral antacids and fluid therapy, and before that, you can evacuate the rumen content. The animal will be very much safe and recover very easily. In some 25% of the cases in teeth, sheep and goat, teeth grinding will be noticed in 25% of the cases. And in many of the cases, inhibitants to anorexia will be there. So inhibitants to anorexia according to the stages of in acidosis. If there is severe acidosis, the animal will be very much complete anorectic. Diarrhea will be present. Dehydration will be noticed. Sometimes sunken eye wall will be noticed. Abdominal distension will be there in some cases. But you cannot come to a conclusion by the temperature and the heart rate and all. You cannot come to a diagnosis. But you can stage the acidosis case. You can stage it. For example, if the animal may be having normal temperature to subnormal temperature, but with this you cannot come to a conclusion the animal is having acidosis. You cannot. So you ignore that. So when regarding the heart rate gives a prognostic indicator. When you are attending a acidosis case and the heart rate is more than 100 or 120, the prognosis will be poor. You have to tell the prognosis to the farmer and tell the outcome of the disease, and then you have to treat the cases so that the outcome will be as the farmer will accept the things. So increase in the heart rate in severe cases is a poor prognosis. In severe cases will be there, and increase in the heart rate more than 100 or 120 will be the poor prognostic sign. And in some cases there will be shallow respiration will be there. The animal will be dull and depressed. That is the most important diagnostic point of view. The animal will be dull and depressed and sleepy behavior. That will be very much dull and depressed. In some severe cases, that will be having staggering gait will be there. Drunken behavior and gait abnormality will be there. So the acidosis animal won't be alert animal. So in ketosis and all, the animal will be alert. In hypermagnesic tetany and all, the animal will be alert. Hyperesis shall be there. Here in acidosis, the animal will be dull and depressed, like as if the animal is sleeping. It will go on like this, sleeping like this. So see the mucous membrane will be normal, and you palpate the rumen for any presence of fluid splashing sound. And when you make the animal walk, it will be having incoordination. In severe cases, the animal will go for recumbency. Here only we will be getting confused. For example, recently cowed animal. It will be cowed 2 days back or 1 week back. The animal is recombinant. So you'll be thinking about milk fever, but the animal may be of acidosis case. So if you are giving calcium wrongly in acidosis case, the animal will die. So diagnosis is very, very important. In acidosis case, diarrhea will be there. Fluid splashing sound will be there in the rumen. In milk fever, there is no milk, rumen fluid splashing sound. There won't be any rumen fluid splashing sound. And the dung will be hard and solid in consistency. So with that, you can easily identify. I will tell you how to treat a case of milk fever and concurrent to the case of milk fever with acidosis in the other last session. Fluid splashing sound will be noticed in the rumen. So this is how you have to. So you have to palpate the rumen like this. So you have to palpate the rumen like this. I think you can able to see the video. Like this, you have to palpate the rumen, left parallel fossa. You have to palpate the left parallel fossa, and you have to go near. And here you have to keep your ears near the left parallel fossa, and you palpate like this, and you see whether there is any fluid splashing sound is there or not. I can tell you, once you started experiencing these things, fluid splashing sound, you can diagnose acidosis within 30 seconds. When the animal is presented to you, just you are palpating the left parallel fossa in the rumen, fluid splashing sound is present, diarrhea is present, you can diagnose it is a case of acidosis. Within 30 seconds to 1 minute, you can diagnose very easily the acidosis case. Okay. For example, the fluid splashing sound, where it will be when it is present in the left parallel fossa in the rumen, it is a clear case of acidosis. If the fluid splashing sound is noticed in the right flank, it could be a case of cecal dilatation or distant loops of intestines. And if they are able to palpate the right lower fluid splashing sound is noticed, it could be a case of intestinal distension. So always keep in mind left parallel fossa and the rumen fluid splashing sound in the rumen is a clear indicator of acidosis. See in this picture, you can able to see the semi-solid dung. So you can say the animal is walking normally, everything normal, feeding habit okay, everything is okay, but passing semi-solid dung is a case of subacute ruminal acidosis. If it is not taking feed, inaptitude to anorexia, fluid splashing sound is there with the diarrhea, it's a clear case of acidosis. You can diagnose very easily. It's a clear case of acidosis. Then here also in sheep and goat, you can able to see the dung consistency very semi-solid in nature. Normally, the consistency of the dung in sheep and goat is a conical shape. It will be pellety in nature. Once it is passing like a cow dung, it is a diarrhea. So in sheep and goat, if it is passing like a cow dung, it is a indicator of it is having diarrhea. So immediately you palpate the rumen, whether it is having fluid splashing sound is there or not, and you correlate with the clinical signs, and you come to a conclusion it's a case of acidosis. And diarrhea is a predominant pathognomonic admin. The predominant clinical signs you can able to appreciate in case of ruminal acidosis. In some cases, there will be complete absence of dung. In some cases, fluid splashing sound will be there, but animal may be in the lateral recumbency, but complete absence of dung will be there. In such a cases, there is a poor prognostic sign. That means very acute, peracute case of acidosis. It's an indicator of very acute or peracute cases of acidosis. In severe cases, vision impairment will be there. The animal cannot able to see. Vision impairment will be there. Recommend same like milk fever. You will be getting confused with the milk fever. So you have to diagnose, differentiate whether the animal is having milk fever or not. Then you have to treat it accordingly. For example, if the recently caught animal is presented with acidosis and the milk fever concurrently, first you correct the acidosis with the sodium bicarbonate with the normal saline and give IV. And then after that, after a few hours, you can correct the the calcium by giving calcium. I will tell you how to give the calcium safely in cases of milk fever, acidosis cases. And evaluation of rumen fluid is very, very important. Once you are having you are an experienced clinician, just by palpating the rumen itself, you can able to identify it's a case of acidosis. Just by history, palpation of the rumen, by the fluid splashing sound in the rumen, diarrhea, you can come to a conclusion of it's a case of ruminal acidosis. But as a early practitioner, as a learner, you can go for rumen fluid examination, and you can come to, for some cases, in few cases you go for rumen fluid examination. It will give you a clue. Once you go on for doing these cases for some 20 or 30 cases, then you come to a conclusion. Oh, this animal will be like this. So this animal will be like this. Like that, you can get some idea. So as a learners, you start doing the evaluation of the rumen fluid examination. Okay. So here, just you can see a chart. This is the basic things we have to learn for the students and the practitioners. It will be given in the veterinary medicine book as a tabular column in the chart. It will clearly identify the peracute, acute, and the subacute cases. It will be very much easy to differentiate. In peracute case, the animal will be severely depressed. The animal will be presented in the lateral recumbency, unable to stand, and apparent blindness will be there. People will be dilated. Here and we will be getting confused whether the animal is having milk fever or not. So in milk fever also people will be dilated. There is no response to any pupillary reflex. The pupil will be dilated and lateral recumbency will be there. So in milk fever there is no diarrhea will be there. In milk fever there is no fluid splashing sound will be there. And the history also you reveal that, and you correlate all these things and treat the peracute case with aggressive fluid therapy with with sodium bicarbonate with the normal saline and aggressive fluid therapy, so that you can maintain the case, and then you can go for the calcium treatment if it is having concurrent milk fever cases. And acute cases, the animal will be depressed, and it will be, when it is walking, it will be having a staggering gait, and the dull and depressed. The animal will be having dull and depressed behavior. Staggering gait will be there, and ataxia will be there. Animal may want to drink, and you should not leave the animal to drink more water, because already the animal is having distended with the rumen with more fluids. So once you leave the animal for taking water access, it will take more water, and the further distension of the rumen will be there. So avoid access water for the animals. And here in acute cases, the people will be slightly dilated, and the response to the pupillary response will be very much poor. In subacute cases, there won't be any prominent clinical signs. Only the thing, the fluid splashing sound will be there, and diarrhea will be there in such a cases. So I will show some of the pictures, videos, just you can go through. Here, the animal is having dull and depressed behavior, oral respiration is there, and vision impairment is there. This is a case of acidosis, severe form of acidosis. So severe form of acidosis. So here, the animal is, you can able to hear the sound like that. That is called grunting. That is called grunting sound. So that is a classical thing of assessing the grunting sound in severe cases. Like that, in sheep and goat, very easily you can able to appreciate, and in large animal also very easily you can appreciate. In septicemia also, the grunting sound will be there. In acidosis also will be there. In peritonitis also, the grunting sound will be there. So you have to differentiate why the grunting sound is coming. Grunting sound with the fluid splashing sound is indicative of acidosis. See? Like that. Like that, the grunting sound will be there. So it's a peracute case of ruminal acidosis. Peracute case of, this is also a case of severe acidosis. Peracute case of ruminal acidosis, and the rumen, the contents got regurgitated. Rumen contents started regurgitation. See, this type of animals, when it is presented to you, this type of animals, when it is presented to you, you can able to assess the prognosis, and you have to tell the farmer the prognosis. So you will be diagnosing the case as very easily as a diagnosis. By clinical science, you have diagnosed the case as a acidosis. So immediately you will be starting the treatment by giving normal saline and with mixing the sodium bicarbonate with normal saline, you will be giving IV. So once you started the normal saline, I mean mixing sodium bicarbonate with the normal saline IV, some 20 or 30 ml will be going on, immediately the animal will die. So the farmer will be blaming you. Sir, the animal was since morning, it was recommended. For him, it was alive and it is recommended like that. Once it is brought to you and once you started the treatment, the animal died. So he will be blaming you. So once you started the treatment, the animal died. So you have given the wrong treatment. He will be blaming you. Why is the reason why the animal died? So you have to tell the prognosis. In case of peracute case or unconscious case, when it is presented to you, when you start the treatment, immediately there will be many biochemical changes will occur in the system. The animal will go for shock condition. The animal will die immediately. So you have to tell the prognosis. Unconscious animal. Once the animal got regurgitation, rumen contents got regurgitation, fluid splashing sound, and the unconscious animals lateral recurrency, when it is brought in lateral recurrency, all such a cases, you have to tell the prognosis very critical, and then only you have to start the treatment. So tell the prognosis, then start the treatment. So here, see this animal, it is having a oral respiration. Here, this animal is having oral respiration, and almost it is going to collapse. In such a cases, when you are attempting to go for the treatment, immediately the animal will die. So you tell the stage of the acidosis. The animal is going to die within critical in nature. It will, but we are trying the treatment and we start the treatment. So in such a cases, whenever you are attending the acute case, peracute cases, before giving the treatment, you tell the prognosis and give the treatment. Otherwise, the animal will die and the owner will be blaming you for the treatment schedule. See, the animal started oral breathing, so the animal is going to die. So you have to tell the prognosis and all. It's a case of acidosis. So diagnosis, very easy. By means of fluid, by history, you can collect the history. Whether they have, what about the feeding, what feeding they have given. But most of the farmers, they won't give the direct question. They won't reveal whether they are fed with the concentrate or not. Then by clinical science, you have to correlate the fluid splashing sound in the rumen, presence of diarrhea and dull and depressive behavior, and rumen fluid examination. Rumen fluid examination is very, very important. As a large animal practitioner, we have to come about for another step in the field practice. You put the stomach tube and collect the rumen fluid examination, and you can assess the rumen protozoa and the pH so that you can easily identify this type of cases very easily. So by putting the stomach tube, you can collect the rumen fluid. It's very easy. The garden hose pipe, you can use it as a stomach tube very easily, and you can use it for the rumen fluid collection. Half-inch pipe you can use it, and very safely you can use it. Even if you are, you can blindly introduce the stomach tube into the oral cavity, it will reach the rumen. It won't enter into the trachea. You need not worry about that. It won't enter into the trachea. Okay, so it's very safe and easy to collect the rumen fluid examination. Many of the practitioners I have seen, they will be doing ruminocentesis. First, they will be doing the rumen puncture by the needle, and they will be collecting the rumen fluid. Instead of ruminal puncture stomach tube, you get the rumen liquor by getting the stomach tube. It's a very easy procedure. Very easy procedure to do it. So this is the for the learners, they can use this type of speculum, prick speculum. So this type of prick speculum they can use. You can use the by means of PVC pipe. You can make it as a speculum, and through this speculum you can put the stomach tube, because the animal will start chewing. But that is, once you got experience, there is no need of using this type of speculum. Once you got experience, directly you can introduce the stomach tube. You just hold the tongue, and just introduce from the side of the mouth, and just introduce gently. Don't go it very fast. Gently you pass the stomach tube, and once it is passed inside, you just leave the tongue. The animal will automatically, it will have the gagging reflex, and you can pass it directly into the rumen. You won't enter into the trachea. No need to worry. Just you attempt the stomach tube intubation. It's a very good clinical procedure. You can diagnose many number of ruminal ailments by means of stomach tube intubation. This is another stomach tube. It's a ProBang with rumen fluid collecting apparatus. It's commercially available. It's cost around 7,500 rupees. Those who are having an institution practice or very big clinic and all, they can get this type of rumen fluid collecting apparatus, and they can use these things. So this is the pedaling. This is the pedal, and it's a small jar is attached to that, and this pedaling, you can pedal it and you can collect the rumen liquor. See, this is a set. It's a pro bag, and this is the pro bag, and this is the jar, and with the nearby is the pedal. I think the mouse is not coming. So with this pedaling method also, you can collect the rumen liquor, and you can collect it very safely. And this is the stomach tube which are used for the small ruminants, sheep and goat. This type of small garden hose pipe, you can use it as a garden hose pipe as a stomach tube for small ruminant, for evacuating and for diagnostic and therapeutic purpose. So this type of small gag are available. Small gag is available for the learners. So you can put the stomach tube through this gag, and you can collect it very easily. In sheep and goat, I mean, especially in goat, you should not put your hand inside the oral cavity. It will bite. It will bite your fingers. So you have to hold the jaw and then gently open the mouth and then introduce the stomach tube. Don't put your hand inside the oral cavity of the goat. It will bite you. Okay. So this is another one stomach tube which can be used in small ruminants. With the gag is available. It's a human stomach tube pump which is available from all surgical shops. It's a rubber tube. It also can be used in for case of sheep and goat. Very easy to collect the rumen liquor and administer. And this is the gas cylinder tube, that tube which can be also used as a stomach tube, which is very much flexible and very easy to collect rumen liquor from the sheep and goat. This is a pH paper. Once you collected the rumen liquor, you can see the pH, and here it is showing the normal pH. Once it is below 3 or 1, it will be showing like that color coordination according to that. So in ruminal acidosis, the pH will be below 5. So below 5 or 5.5, it will be showing the rumen pH, so that you can easily diagnose. So once the rumen liquor is collected, immediately you have to assess the rumen pH. Once it is exposed to the air for a long time, it will show the alkaline pH. So you'll be getting confused at that time. And another thing, when it is contaminated with the saliva also, it will get alkaline in nature. So you have to correlate with the rumen pH and also the rumen protozoa. You have to correlate the rumen presence of any rumen protozoa. For that, you can use the hand microscope. Microscopes are available in the market, and you can collect the rumen liquor on the spot, and the field condition itself, you can use it. Put your drop of rumen liquor in a slide and put your cover slip and see it under low power. I mean the low power microscope if you're having microscope, or you can use this type of microscope. Here, this type of pictures will be able to see. Here you can able to see large number of protozoa. So many number of protozoa is present in the field that you can say it as a 3+. More than 30 present in a field, you can term it as 3+. So it is an active microflora. So when you are collecting a rumen liquor from an animal and you are able to see this type of protozoa, it's not a case of acidosis. It's not a case of acidosis. It's a healthy animal. It's a healthy animal. So once you are able to see the large number of protozoa like this, it's not a case of acidosis. Well, then how it will be a case of acidosis? It will be like this. See, the rumen liquor will be watery in nature. The rumen liquor will be milky white in nature or watery in nature, and like this color will be milky white in nature. Here, this is a microscopical view. There is no protozoa at all. Here, the protozoa is nil. So it's a clear case of acidosis. So by evaluation of rumen protozoa, you can easily identify the acidosis in the field conditions. If you are having the microscopic facilities with a slide, very easily you can identify. If you are having a doubt, as a learner, once you try it for few cases, then you need not go for each and every case of microscopical evaluation. Just by seeing the clinical signs, you can start the treatment. Okay. So here I am showing another picture. Here, a video. Here there is presence of large protozoa. So can you say it is a case of acidosis? No, it is not a case of acidosis. The rumen liquor is having large number of protozoa. It is healthy in nature. So it's a normal one. Okay. So once you see the normal movement of the protozoa more than 3+, it is a normal one, normal animal. If there is no protozoa or complete absence of the protozoa, then you can term it as a case of acidosis. Okay. Sometimes you may be seeing very few protozoa here and there, 1 or 2, very few. In a field, you will be seeing around 5 to 10 protozoa. That is also acidosis, a mild form of acidosis. We can tell it. So rumen fluid examination, the pH will be below 5.5. The pH will be below 5.5, and the consistency will be watery in nature and milky white in color will be there. And microscopic evaluation, the low power, there will be no protozoa, complete absence of protozoa will be there. And absence of, in some cases, absence of large or medium sized protozoa is also indicative of moderate acidosis. Okay. And the differential diagnosis includes that in cases of milk fever, differential diagnosis in peracute cases, not all cases. Peracute cases of acidosis or acute cases of acidosis will be correlating with the milk fever. Okay. And peritonitis. In peritonitis, there will be no fluid splashing sound in the rumen. The dung will be void, pellety in nature, or small quantity of the dung will be there. There won't be any diarrhea. So grunting sound will be there in peritonitis. So there won't be any fluid splashing sound in case of peritonitis, so that you can easily identify. And in peritonitis, when you put the abdominal synthesis, free flow of peritoneal fluid will be noticed, so that you can easily diagnose whether the animal is having peritonitis there or not. In septicemia also, there will be subnormal temperature will be there. There is no fluid splashing sound in the rumen. The mucous membrane will be congested, so that you can differentiate the condition from septicemia. All this differential diagnosis I have put only for severe form of acidosis, not for standing form. Not for standing form of acidosis. When the animal is brought in lateral recumbency, these are the differential diagnosis. Not for the standing cases or the walking cases of acidosis. Okay. And subacute ruminal acidosis, you have to differentiate from simple digestion. And in small ruminants, especially, you will be getting confused in case of fluid splashing sound will be there, diarrhea will be there. In case of enterotoxemia, you will be getting some confusion with acidosis. Enterotoxemia, sudden onset will be there. During the grazing, the farmer will be telling there is no feeding of any concentrate, anything like that. The animal was meant for grazing. Suddenly it developed convulsions will be there. Convulsions with the teeth grinding and a severe form of fluid splashing sound with the diarrhea with the convulsions is a classical case of enterotoxemia. So you can differentiate this type of things from the other cases. What are the poor prognostic indicators in case of acidosis? Complete absence of dung is a poor prognostic indicator. Increase in the heart rate. For example, when a case is presented to you in the lateral recumbency, you are treated the case and successfully you are treated everything according to the schedule. Sodium bicarbonate with the normal saline, the fluid therapy, everything you are given, and you are seeing the heart rate. If the heart rate is more than 120, the prognosis will be poor. After 6 hours, you are seeing the heart rate. If the heart rate is still 120 above, the prognosis will be poor. If the heart rate is reducing after the treatment, if the heart rate is reduced, for example, from 120 to 90, the prognosis will be favorable prognosis. So by assessing the heart rate, you can tell the prognosis. And lateral recumbency with all reduced reflexes will be also a poor prognostic indicator. Now, once the animal is brought to you with the dilated people, mostly the prognosis will be unfavorable in such a cases. And oral respiration cases, once the animal is brought to you with the lateral recumbency, the animal is having severe form of acidosis with the oral respiration, the prognosis will be very much poor. These are the prognostic indicators. You have to assess the clinical signs and you have to get the bonus. In what are the cases you will be feeling the grunting sound. So in grunting sound, diffuse peritonitis is also grunting sound will be there. Like that sound you can able to appreciate. That is called a grunting sound. In each respiration, you can able to hear a sound that is called a grunting sound. Once you can hear it from the distance, in sometimes you can able to hear by auscultation of the trachea. So what you have to do, you have to auscultate the trachea. Auscultation of the trachea by we use the stethoscope. You keep the diaphragm of the stethoscope in the trachea and you auscultate. You can easily appreciate this type of grunting sounds, and you can. So suppose when I'm examining a case, I am going to examine now a case, and I am auscultating the trachea. The animal is evincing the sound like this, like that. It's coming. Immediately, what I will do, I will immediately go on palpating the rumen and see whether the animal is having fluid splashing sound is there or not. If it is having fluid splashing sound with the grunting sound is there, it's a case of acidosis. Diarrhea is there, it's a case of acidosis. If I am doing the fluid rumen percussion, palpation and percussion of the rumen, I am doing, there is no fluid splashing sound in the rumen, it's not a case of acidosis. So what I used to do, immediately I will put the abdominal synthesis and rule out peritonitis. This is how we have to differentiate and classify and come to a clinical examination. And distension of the stomach and intestines, pleuritis, subcutaneous emphysema, pulmonary emphysema, in pneumonia, all these cases, grunting sounds will be there. In emphysema and all, you can easily identify by means of crepitation sound will be there throughout the body. In pneumonia, exaggerated lung sounds will be there, so that you can differentiate all these conditions very easily. Again, you have to keep it in mind. The fluid splashing sound is the pathognomonic classical signs of acidosis in the sheep and goat and cattle. Okay. So in clinic, when you are having a laboratory facilities, you will be having these things. Otherwise, in field conditions, you need not to worry about these things. When academic or when you are working in the institution, or if you are having facilities for conducting the whole blood exam, I mean the complete blood examination count, you can see if there is any increase in PCB, that indicates dehydration is there, and there will be secondary hypocalcemia will be there due to malabsorption will be there, and which rumen pH evaluation, the rumen pH will be reduced to below 5, and microscopical evaluation of rumen protozoa, you can very easily diagnose the case of ruminal acidosis. Here, when the principles of treatment, this is the principle of treatment. I'm not going to tell about the treatment. I will tell the treatment in the coming slides. This is the principle of treatment. The first principle of treatment is the evacuate the rumen content. I have not mentioned here. The first principle of treatment is the evacuate the rumen content. For example, when the animal is brought in the lateral recumbency, you have to make the animal in the sternal recumbency, then put the stomach tube. Don't put the stomach tube in the lateral recumbency. The animal will go for asphyxia. To make the animal in the sternal recumbency, put the stomach tube. And if the animal is in the unconscious stage, you need not go for the rumen stomach tube. You can go directly for the treatment. You don't go for the stomach tube intubation. Okay. If the animal is somewhat conscious, then you go for stomach tube intubation, evacuate the rumen content, and correct the ruminal and systemic acidosis. How will you correct the ruminal acidosis? By giving oral antacids. If the animal is unconscious, don't go for oral administration. Okay. First you treat the animal. From the lateral recumbency, you bring it to the sternal recumbency. Once the animal becomes consciousness, then only you have to go for oral antacids. Otherwise, in unconscious animal or in lateral recumbency animal, don't go for the oral drenching or oral administration of any antacid as a preliminary treatment of acidosis. Okay, there you have to go for treatment with the parenteral IV administration. Restoration of fluid and electrolyte loss, that is most important. Correct. We have corrected the ruminal acidosis with oral antacids. Systemic acidosis with sodium bicarbonate. Restoration of fluid and electrolyte balance, fluid therapy. You are giving fluid therapy. Restoration of post-stomach and intestinal motility to normal by fluid therapy. Prevent further access to the feed or water for 12 to 24 hours and supply good quality of palatable hay when the after that is after recovery. These are all after the recovery, the principles of treatment. If it is a case of severe case, the animal is in severe depression, hypothermia, prominent ruminal distension, and the heart rate is more than 120, like that, the pH is below 5. In such severe cases, even you can go for option of ruminotomy also. You can go under ruminotomy, evacuate the rumen content, and then you can go for the further treatment with the fluid therapy and other things. But the prognosis will be always guarded to whoever, but the decision makes according to the clinician on the spot, or whether to go for ruminotomy or the medical management of acidosis. You just keep it in mind that the systemic form of acidosis, you will be treating the animals with the 5% sodium bicarbonate. So many of you will be having doubt, don't get confused. This is what is mentioned in the textbook. So either you can do it in this way or another way, just you keep it in mind. 5% of sodium bicarbonate, 5 liters for an adult animal, you have to give 5% sodium bicarbonate at the rate of 5 liters for the adult animal, 40 kg for a period of 30 minutes. So I have seen many veterinarians, they used to have mix the sodium bicarbonate powder in normal saline. We used to give it. Okay, well and good, but you should give it as a 5%. That is most important. You are giving excess sodium bicarbonate. What will happen? That will lead to hypokalemia, and the animal will go for downer cow syndrome. You can't get the animal get up. So instead of correcting the acidosis, you will be leading the animal to downer cow syndrome, like that. So take care when you are using the powder form. When you are using the powder form, you have to exactly use the concentration of 5% concentration, and you can give it as 5 liters for a period of 30 minutes, followed by 1.3% of sodium bicarbonate at the rate of 150 ml per kg body weight for the next period. So this is a standard treatment protocol mentioned in the textbook. You can use this type of treatment also, or otherwise you can go for the other line of treatment I will be telling you. You can go for rumen lavage. So in some cases, you'll be in the intuition when there is a suction apparatus is available, we can go for rumen lavage. Warm water is pumped into the left parallel fossa and it is emptied, and then later it will be administered with magnesium hydroxide and magnesium oxide or magnesium carbonate with mixed with water. Will be pumping inside, and that is in case of, not in case of lateral recurrency animal. In case of some acute cases, standing animal, you can use. Okay, not in case of unconscious animal. So this type of stomach tube can be used. This type of stomach tube can be used. This type of stomach tube can be used for drenching alkaline agents. You can drench magnesium hydroxide or sodium bicarbonate or magnesium hydroxide or magnesium carbonate, and you can mix it with water and drench it for. This is a suction apparatus. You can remove the rumen content. You can remove the rumen content, and it's a suction apparatus. You can remove the rumen content by, once you introduce a stomach tube and you connect it to the suction apparatus and you switch on the thing, automatically the rumen content will be evacuated. These things are also available. So here, this is the actual line of treatment that we have to follow in the field conditions. I mean, evacuate, the first and the foremost thing is to evacuate the rumen content. Okay, you evacuate the rumen content first, the animal will get relief. Then you give sodium bicarbonate, mix it with the normal saline and give IV. Okay, here we have to take care. The sodium bicarbonate, which is available as a 7.5% solution in the market, you can use it. Some practitioners, they use it as a powder form. Okay, otherwise 7.5% as a 100 ml vial or a 10 ml ampule or 20 ml ampule are available in the market, that you can use as a sodium bicarbonate, and you have to mix it with normal saline and give IV. For example, in some cases in large animal, I used to give direct IV of sodium bicarbonate. Nothing will happen. But in sheep and goat and all, whenever you are giving direct, you have to take care. Rapid alkalization will lead to suddenly shock will be there, the animal will collapse. So especially in sheep and goat, always for a safer side, you mix the sodium bicarbonate with the normal saline and give IV. In large animal also, you mix the sodium bicarbonate in some normal saline. There is no quantity of the normal saline. In such a 10 sachet you have to mix, 5 sachet you have to mix, not like that. You just mix it with some normal saline and give IV. So it's better safe to mix it with normal saline and give IV. That instead of giving direct IV, you can mix it with normal saline and give IV. And antihistamines, in the pathogenesis we have seen the animal, there will be histamine release will be there. So we are giving antihistamines. Chlorpheniramine malate can be given as a part of line of treatment. And the B complex injection is a must in the follow-up treatment of acidosis, especially thiamine. Thiamine is essential as a coenzyme. Thiamine is essential as a coenzyme. It will trigger the TCA cycle. Accumulated lactic acid will be triggered by the TCA cycle. So that needs thiamine supplementation. So B complex supplementation is very important. Then all other things are for the secondary line of treatment. The primary line of treatment, the day one, evacuate the rumen content, sodium bicarbonate in normal saline, IV, fluid therapy, and antihistamines, B complex, you can give all these things. Then for follow-up, but second line of treatment or second day follow-up, you can give the oral antibiotics and oral antacids. Oral antacids, the same day also you can give. The animal is palatable. The animal can able to consume the antacids, you can give. The animal is in the lateral recurrency area or unconscious animal, don't go for oral antacids. Okay, oral antacids can be given. And for follow-up cases, you can give probiotics and cut transplantation can be given. When the animal is not taking feed and all, you can go for probiotics and cut transplantation. So here you can evacuate the rumen content by putting the stomach tube, and you can evacuate the rumen content. And see, in this animal, this is a case of acidosis. Then it's very watery in nature. You have put the stomach tube and we are removing all the rumen content. Before treatment, you are removing the rumen content completely. So it's a very good procedure. By using the stomach tube, we can use the garden hose pipe. Half-inch hose pipe can be used very easily. So the watery rumen liquid is evacuated completely. It's a case of acidosis, having fluid splashing sound and diarrhea is there, and dull and depressed. An animal is standing. So first line of treatment, we evacuate the rumen content. And this is another one picture. It shows the evacuation of the rumen content in this goat. You can use the small stomach tube and evacuate the rumen content. See, You can evacuate the rumen content. Here also you can able to appreciate the grunting sound. So put the stomach tube and evacuate the rumen content. And this type of the stomach tube can also be used for evacuating the rumen content. Once you introduce the stomach tube, see this animal, you can say whether this animal is alert or not. It is dull and depressed. It's very much dull and depressed. It's an acute form of acidosis, severe form of acidosis. So you are evacuating the rumen content. So after evacuating the rumen content, you are giving sodium bicarbonate with the normal saline IV, then oral antacids. So now we come to the calculation. This is the main point in the session. So previously we have seen our what is mentioned in the textbook. Both the things you can use. 5% of sodium bicarbonate, 5 liters, followed by 1.3% of sodium bicarbonate. You can use at the rate of 150 ml per kg body weight. That's a standard treatment. Okay. Or otherwise, you can calculate according to the body weight. 0.3 into base deficit into body weight is equal to, gives about how much of milliequivalent of sodium bicarbonate you have to infuse for that animal. You have to give for that animal. So 1 ml of sodium bicarbonate which is available in the market contains about 0.9 milliequivalent. That is approximately equal to 1 ml is equal to 1 ml is equal to 1 milliequivalent of sodium bicarbonate. 1 ml is equal to 1 milliequivalent of sodium bicarbonate. Okay. So base deficit is the standard one for mild form of acidosis, moderate form of acidosis, severe form of acidosis. They have kept a standard like this. They have kept a standard. You need not worry about that. That indicates 5, 10, 15. Mild form of acidosis means 5. For example, how you will assess the case of mild form of acidosis? The animal is brought to you with the walking condition, just is having diarrhea is there, animal is alert, mild fluid splashing sound is there. This is a case of mild form. Moderate form, the animal is dull and depressed, heart rate is slightly elevated, fluid splashing sound in the rumen, diarrhea is there, staggering gait is there. The animal may walking and is lying down frequently, or staggering gait is there. So that's a moderate case. The animal is sleepy behavior, drunken behavior, like this. It lowers the head down and it will be sleepy like this. It's a moderate case. Severe case, the animal is brought with the sternal recurrency or lateral recurrency with the fluid splashing sound, diarrhea. It's a case of severe. So that you can easily identify whether it's a case of mild, moderate, or severe. So in the calculation, you can fit these things 5, 10, and 15. 0.3 into base deficit into body weight. Okay. So here is a calculation. Now we can calculate a crossbred Jersey cow is brought to you is about 400 kg body weight. Is having severe ruminal acidosis. The heart rate is more than 120. The animal is recommend and fluid splashing sound is there. The animal is in unconscious state. So naturally, how will you term it? It's a severe case. Okay. So naturally 15. We used to bring it as 15 here. 15. So 0.3 into 15 into 400 is equal to, it gives around 1800 milliequivalent of sodium bicarbonate. Already we have seen 1 milliequivalent is equal to 1 ml is equal to 1 milliequivalent. So how much we have to give this animal? 1 ml is equal to 1 milliequivalent. So naturally we need 1800 ml is needed for this case of treating this animal. So we have to give 1800. I mean 1800 ml of sodium bicarbonate is needed for this animal. How we will give? We will be loading this 1800 ml in normal saline. You have to collect the normal saline. You connect the normal saline sachet and you cut the sachet in the top and you can pour 1800 ml frequently in that normal saline sachet and you can give IV. Or you can give it in 1 or 2 sachets, divide it also. There is no hard rule how much you have to give in a 1 sachet like that. Okay. So in NS, you mix it and give IV. That's enough. You should not mix it with the DNS. You take care. You should be mixing with only normal saline. I hope you understand this point, this calculation. And same thing, if it is a case of goat, a goat weighing about 40 kg body weight, suffering from severe ruminal acidosis. Animal is standing posture, fluid splashing sound is there. Okay. So here the animal is in the standing posture, fluid splashing sound is there. So here naturally you can put it as a acidosis mild or moderate. Either you can calculate as a mild case or moderate case. So 0.3 into base deficit 5 or 10 you can put into body weight 40 gives around 60. So here 60 ml of sodium bicarbonate is needed for treating this animal. So I have seen many of the practitioners, they used to diagnose the case very easily, but the success rate is very low. Why? The reason is that they may not be using the proper amount of sodium bicarbonate. So instead of 60 ml, they will be giving around some 10 ml or 20 ml of sodium bicarbonate in such a cases, so that the recovery will be very poor. And the fluid therapy may not be administered, so that the recovery may not be there. And they would have not evacuated the rumen content. These three things plays important role in case of recovery success rate. Okay, the success rate depends upon the evacuating rumen content, quantity of the sodium bicarbonate according to the calculation, and aggressive fluid therapy will give the success rate, maximum success rate for the ruminal acidosis. I hope you understand this calculation in the goat also. So mild means 5, moderate you calculate it as a 10 best deficit, severe cases you put it as a 15 and calculate it. So for practitioners, we cannot able to calculate in each and every case, single case 0.3 into best deficit like that. You cannot calculate in a single case. You can go for a thumb rule. For a mild case, you can go for the 1 ml per kg body weight. Severe ruminal acidosis case, 2 to 3 ml per kg body weight. Very simple. For 300 kg body weight, 300 into 3, 900 ml. At least you give 900 ml, the animal will get recovery. For 400 kg body weight, 1200 ml. That's all. The 30 kg body weight goat having ruminal acidosis severe form, 30 into 2, 60 ml. Give with mix it with normal saline, give IV. That's enough. This is a simple protocol. You have to keep it in mind. Okay. And regarding the fluid therapy, that's very important. Many of the practitioners, you would have be treating the well with sodium bicarbonate with normal saline, 1 or 2 sachets. They would have ignored the fluid therapy because animal is having dehydration. The clinical science we have seen already, the animal is severely dehydrated, sunken eyeball. Fluid therapy does the miracle. Once you give large volume of fluids, the success rate will be more. The next day, the animal, you can see the animal standing first. Once you give fluids, ringer lactate. What is the selection of fluid therapy? Normal saline or ringer lactate you can give. So this is the large animal infusion pump. So this is the large animal infusion pump, especially devised for large animals. You can use this type of things. You can pump some 10 liters of fluid within 15 minutes, 5 liters of fluid within 10 to 15 minutes you can pump. So what are the fluids you should not give in this type of large animal, I mean infusion set? You should not give calcium in this IV set. Calcium should not be given. Potassium chloride should not be given. D20 should not be given in this type of IV set, large animal infusion set. You can give normal saline or ringer lactate in this type of IV set. Okay. So many of the practice they used to ask a doubt whether I can give DNS to animal which is suffering from ruminal acidosis. You should not give DNS. Don't administer any type of dextrose solutions in any form in the case of ruminal acidosis. The selection of fluid is only normal saline or ringer lactate. Okay. Sodium bicarbonate should be mixed only with normal saline. Don't mix it with ringer lactate. For reconstitution, you can mix it with normal saline only. Don't mix it with ringer lactate. Okay. So here already we have seen the treatment protocol. Evacuate the rumen content. Give the sodium bicarbonate. Mix it with normal saline. Give IV. Antihistamines, B complex, oral antibiotics, oral antacids, and probiotics, and cut transplantation in case of follow-up. What is the cut transplantation? So, for example, you have treated a case of acidosis successfully. You have treated a case of acidosis successfully. The next day, the animal is not taking feed. Okay. The next day, the animal is not taking feed. The owner is asking, the animal is not taking feed, but the animal from the sternal recumbency, it got to the standing posture. So everything is okay. But the animal is not taking feed properly, or is taking little much water alone. So in such a case, you have to go for cut transplantation. Don't repeat the sodium bicarbonate solution. I mean IV. Okay. If he is saying the animal is not taking feed, many of us used to repeat the sodium bicarbonate. Don't repeat. The animal is excellent. Everything is normal. Only the thing animal is not taking feed. The vitals are normal. You go for administration of cut transplantation. Cut transplantation means collecting the rumen liquid from the healthy animal and administering to the affected one. For cattle, you can give 5 liters orally. For sheep and goat, you can give 1 liter orally. Okay. How to collect? You can collect it from the healthy animal by putting the stomach tube, or you can use the probiotics can be used. Okay. Rumen buffers. What are the rumen buffers? Sodium bicarbonate, magnesium oxide, magnesium carbonate, sodium bentonite, magnesium hydroxide, aluminum hydroxide. All these things are rumen buffers or antacids can be used for the oral antacids in case of treating ruminal acidosis. All these agents are available in the market. Sodium bicarbonate is available in the market. Magnesium oxide 1 gram per kg body weight you can use. Magnesium carbonate, light magnesium carbonate 0.5 to 1 gram per kg body weight can be given. Magnesium hydroxide, aluminum hydroxide are always used as many commercial trade names are available with bloat agents and anti-bloat agents. You can use these things as a rumen buffers or antacids. Okay. And prevention and control, the period of adaptation will be that. I mean, the prevention of acidosis, gradual adaptation will be there. Sudden excess of carbohydrate will lead to acidosis. Gradual period of adaptation will lead to adaptation of the rumen for grain feeding. And small incremental increase in the grain feeding can be advised. And usage of dietary buffers can be used, as already told. Rumen buffers can be used, and you can prevent control the acidosis conditions. So now we'll go for some exercise, few exercises before closing the session. Few case discussion, I will giving a case discussion. So number one, a cow in a dairy farm which is passing a loose dung. You are going to a farm and you are examining a cow. It's passing loose dung with the bubbles, and the owner is telling the reduction in the milk fat percentage and the reduction in the milk yield is there. And feeding habit, everything, water intake, everything is normal. Vital signs, everything normal. What is your diagnosis? So from this session, you could have come to your mind. Now you can recall what would be a diagnosis. You can recall in your own mind, and you can diagnose this case. Okay. So it's nothing but it's a case of SARA, subacute ruminal acidosis. Animal is active, alert, feeding habit, everything normal. Only the thing, animal is passing loose dung, but dung is wider with the bubbles. Undigested grain material is there, or undigested fiber is there. So it's a case of management SARA, subacute ruminal acidosis. So in such a cases, how will you treat this type of cases? You can treat it with the oral antacids or oral buffer agents are available that you can give to these animals, like Rumibuff or sodium bicarbonate or any other oral antacids you can use. And with the probiotics, any probiotics which is available can be used. The animal will become normal. This is one type of case, subacute ruminal acidosis. Okay. And correction of the feeding pattern. So feed more amount of roughages and restrict the grain feeding or split the concentrates. Split the concentrate for 2 to 3 times a day so that you can manage this type of SARA. Okay. And differential diagnosis of diarrhea. Sometimes the diarrhea means the owner will be telling diarrhea, but you have to see how the diarrhea is there, and you should not get confused with the diarrhea of other causes. So diarrhea means how it should be in case of acidosis. That you have to keep it in mind. There are many types of diarrhea is there. That's why I put like this some pictures for your refreshment. If you come across a diarrhea with like this fibrinous cast, intestinal fibrinous cast is coming back, it's a clear case of guttural enteritis, diphtheritic or guttural enteritis due to bacterial origin. This is bacterial enteritis. Okay. So the farmer will be telling, sir, the animal is not taking feed, animal is passing diarrhea. Immediately you should not switch over to a case of acidosis. You have to see the nature of the diarrhea. If it is like this, it's a case of fibrinous cast, it's due to bacterial enteritis. See, fibrinous cast is available in this picture. This is a case of bacterial enteritis. It is not a case of acidosis. Okay, it's a bacterial enteritis. So here also you can able to see the mucosal shreds are there and loose dung is there, semi-solid, I mean watery in nature with this stress. Mucosal shreds are there. It is a bacterial enteritis. So it's not a case of acidosis. Here also you can able to see the mucosal shreds are there and dysentery and blood injury is there. So it is also a case of bacterial enteritis. It's not a case of acidosis. Now we can recall whether it is a bacterial enteritis or acidosis. You can clearly say it's a case of acidosis. You can say it's a semi-solid dung, bubbles are there. So it's a case of acidosis. So see the animal is having fluid splashing sound is there or not. Then you come to a conclusion it's a case of acidosis. See here you can able to see the grains, undigested feed materials are present in the grain. So it's a case of acidosis, ruminal acidosis. Here also you can able to see the grains present in the dung. So it's also a case of acidosis. So here colon markings are there. The dung is semi-solid, not semi-solid, it's a solid in nature with undigested fiber material. Colon markings are there. It's not a case of acidosis. Okay. Here undigested feed materials are there, but the animal is not a semi-solid, it's reduced quantity of the dung is there. Two things you have to rule out. One thing, whether it is having fluid splashing sound is there or not, you have to think about. If there is any fluid splashing sound in the rumen and it is having fibrous material in the dung, it's a case of acidosis. If no fluid splashing sound and the animal is passing this type of fibrous material of dung material, it's a case of foreign body syndrome. You have to think about any peritonitis or like that, foreign body syndrome. Okay. So this is a case of like mucosal shreds, like noodles, like thing, mucosal shreds is coming. So this is a case of bacterial enteritis, not a case of acidosis. Okay. So when you come across this type of jelly-like consistency of a dung, it's a case of intestinal obstruction. Okay, it's not a case of acidosis. If you come across this type of dung material, dark tarry color thing, is indicative of abomasal ulcers. So it's indicative of abomasal ulcers, not a case of acidosis. So here, undigested feed materials present, it is a case of acidosis. Here, it's a case of acidosis. Okay. Semi-solid in nature, diarrhea is there. It's a case of acidosis. Diarrhea with submandibular edema is there, with hypoproteinemia, you have to think about any worm infestation. Okay. For example, when there is any submandibular edema like this, bottle jaw is there, with the diarrhea is there, you think about amphistomes. So like that, you have to think about various consistency of diarrhea and you have to come to your conclusion. And number 3, case discussion 3, the mild 250 kg body weight of crossbred dairy cow has consumed more concentrates and the inappetence is there, mild fluid splashing sound is there, and all vitals are normal, and that is reduction in the milk yield. So it's a mild form of acidosis. The owner is bringing the animal with inappetence, mild fluid splashing sound is there, semi-solid dung is there. You can term it as a mild form of or subacute form of ruminal acidosis. In such a cases, just you can give fluid therapy, that will be enough, and oral antacids. Just giving a fluid therapy with oral antacids will correct this type of mild form of subacute ruminal acidosis, and give some supplementation of probiotic bolus. That's enough for such a type of cases. Okay, there is no need of giving sodium bicarbonate in case of mild, subacute cases. Okay, oral antacids would be enough. Here, a 30 kg body weight is presented with the fluid splashing sound in the rumen, and the semi-solid dung is passed. Animal is not taking feed. Animal is walking normal gait. The animal, they are bringing the wort in the walking post. It is coming walking normally, and it is presented to you. But fluid splashing sound is there. Semi-solid dung is there. In such a cases, you can treat it with the oral antacid. 2 line of treatment you can give. Either you can give oral antacid with the fluid therapy, normal saline or oral you can give. Or otherwise you can give sodium bicarbonate around 30 ml, 1 ml per kg body weight. 30 ml mix it with normal saline, give IV. Followed by oral antacids. Okay, the animal become normal. Okay. And moderate cases of acidosis, a 250 kg body weight has consumed more amount of concentrates. The animal is showing signs of inappetence to anorexia, fluid splashing sound is there, diarrhea is there, dehydration is there, and the animal is standing posture or recumbent posture, whatever it may be. You can go for moderate, you can term it as a moderate acidosis. You can go for the treatment for sodium bicarbonate. 2 ml per kg body weight. Suppose if you are taking 2 ml per kg body weight means 250 into 2, 500 ml. Mix it with the normal saline, give IV. In illness, you can give. And you can follow up with the fluid therapy. You can give with the normal saline or ringer lactate. You can give the fluid therapy. The fluid therapy we are giving for dehydration, not correcting the acidosis. Okay. So you may be asking a doubt whether you can use ringer lactate in the acidosis case. Here we are giving ringer lactate for correcting the dehydration. Okay. After giving sodium bicarbonate with normal saline as IV, you are giving ringer lactate for correcting the dehydration. So you can give. Okay, no problem. Then you can supplement B complex. So this line of treatment can be followed for the moderate acidosis cases. And antihistamines are administered. Probiotics are given for this animal. Okay. And like this type of severe type of case, animal is brought with your, you are attending a case of acidosis with channel recumbency or lateral recumbency, and pupillary reflex are absent, pupil are very much dilated. This type of rumen content or regurgitation is noticed. This is our severe cases of ruminal acidosis. So this animal, see in this picture, the animal is in the lateral recumbency, all reflexes are reduced, rumen content started regurgitation. In this type of cases, before starting the treatment, you have to tell the prognosis and start the treatment. Okay. So tell the prognosis, it is poor. I'm going to start the treatment. The animal may die at any time. Then you start the treatment. So the attempting the treatment is very good, but tell the prognosis and start the treatment. See this type of case, the distended abdomen is there, bloat is there. You can see the diarrhea is there. So you can see the diarrhea. Animal is having fluid splashing sound in the rumen. Animal is dull and depressed, lateral recumbency, diarrhea is noticed. And see, animal is in unconscious state. So this was the severe form of acidosis. Severe form of acidosis. So what we have see, this is a case of acidosis with hypokalemia. For example, there are two reasons of hypokalemia. One thing, because of excess administration of sodium bicarbonate, the animal may go for hypokalemia. For example, you may be administering a case of acidosis case treated with some 1 liter of sodium bicarbonate. Second day also you would have administered the same type of 1 liter of sodium bicarbonate or severe more amount of sodium bicarbonate. Sodium bicarbonate excess, if you are administered, that will lead to hypokalemia. Potassium level will come down, so the animal won't get up. The animal will go for hypokalemia. The animal will be in lateral recumbency. If it is cannot be able to keep the neck as it is the normal position because of the muscular weakness, lateral muscle, the neck muscle weakness. The animal will go for S-shaped. Will keep the head on the flank. Okay, it will keep the head on the flank and it will lie like this. So when you are attending this type of cases, you will be mistaking like this. It's a case of milk fever. So you'll be giving calcium. So the animal won't respond to the treatment of calcium. So how to differentiate? And another cause of the thing, the animal because of hypokalemia, unresponsive cases. When you are treating with the calcium and during the recovery phase, when you are treating with the calcium and the animal is not responded to calcium, still it maintains the posture of this type of lateral deviation of the head. You think about hypokalemia. Okay. So these things you have to keep it in mind. The reason for hypokalemia is that number one, excess administration of sodium bicarbonate, and number two, anorectic, prolonged period of anorexia and will lead to secondary hypokalemia. So how to treat this type of cases? Already you have treated the case, this type of acidosis case. Already you have treated with sodium bicarbonate and fluid therapy. Now we are correcting the hypokalemia with the potassium chloride syrup. Orally you can administer potassium chloride syrup. You can give. Either the syrup form is available, 200 ml bottle is available, or powder form is available. Both either anything you can use. If it is a powder form, you can use 100 to 150 gram. Mix it with water and drench it without aspiration. You can drench it orally. If it is a 200 ml bottle, you drench it morning 2 bottles, evening 2 bottles, 2 bottles BID orally, so that the potassium level will be increasing slowly. And you can give it IV, means potassium chloride can also be given IV. Injection also can be given IV, but it should be given only after seeing the serum potassium level. If without seeing the serum potassium level, you should not give potassium chloride IV. The dose is 0.5 milliequivalent per kg body weight. Okay. In generally, all both oral and other things, 0.5 milliequivalent per kg body weight orally or IV you can give. IV you have to give only after seeing the serum potassium level. And if the serum potassium level is only below 3.5, you can go for IV preparation. For example, how to give that IV preparation, I have already told in many classes. So in one normal saline sachet, you should not mix not more than 40 ml of potassium chloride solution. Okay, and you have to give it very slow IV. Potassium should be given rather than like calcium. You have to give it very slowly. For example, 5 ml of normal saline sachet, you are mixed 40 ml of potassium chloride, means you have to give it over a period of half an hour. So that disadvantage is that. The disadvantage of giving IV is that it will develop cardiac arrhythmia. The animal will die because of cardiac arrhythmia. So always the safer side of administration is oral administration of potassium. Don't go for IV administration of potassium chloride. Never go for IV administration of potassium chloride without seeing serum potassium level. Go for oral potassium syrup or powder. It will be very fantastic and excellent result will be noticed. And for follow-up, you can go for ringer lactate. Ringer lactate contains potassium chloride solution that can also be given IV. And no need to repeat the sodium bicarbonate solutions in such a type of cases. Okay. So this is another case. The case of acidosis. Here, there's a fluid splashing sound is there. The animal was brought with the lateral recumbency and it was treated with sodium bicarbonate, and it was brought to the hospital with the lateral recumbency. And the pupil is very much dilated, and the animal was already treated with sodium bicarbonate, fluid therapy, everything given, but not responded. Okay, see, the animal is having respiratory distress, and the animal is in the lateral recumbency, and the animal has consumed the carbohydrate 1 day back, and it was treated with the sodium bicarbonate and the fluids, everything, and not responded, and still in the lateral recumbency. And it was people was very much dilated, and so temperature is subnormal in nature. We are given calcium borogluconate. How much you have to give calcium borogluconate? In the first case, for example, you are attending a case of acidosis case. Primarily, you should not administer calcium. First, you have to correct the acidosis. First, you have to correct the ruminal acidosis. After 6 hours, the animal is showing signs of, or the next day, the animal is showing signs of hypocalcemia like signs, you can go for calcium treatment. Not in the primary treatment. You keep it in mind. If you are giving a treatment, if you are giving calcium as a primary treatment for ruminal acidosis, the animal will die. Okay, so you have to take care. Once the animal is not responded to your treatment, once it's going for secondary hypocalcemia, pupillary dilatation is there, the animal is becoming somewhat alert, not able to get up. In such a cases, you can go for calcium. Always go for a safer side. You can mix the calcium with normal saline and give IV. Okay. So this is the response after giving calcium. After giving calcium, the animal responded well and it became normal. After 2 to 3 hours, it became normal and it was in the standing posture. So in case of acidosis, primarily you should not give it as a treatment with the calcium. Only for the after correcting the acidosis with the sodium bicarbonate with the normal saline IV, and if there is no improvement and all, pupillary dilatation is there, subnormal temperature is there, signs of hypocalcemia is there in the notice, the next day or after the 6 hours, whatever may be the thing, you can give calcium. So the safer side of giving calcium, what I used to do, safer side, I used to mix calcium in the normal saline and give IV, so that it will be very safe. It won't give any untoward reaction. Or otherwise, I used to give subcutaneous injection. For example, 250 ml, I used to mix it with the normal saline and give IV, and the remaining 250 ml, I used to give subcutaneous. So when you are giving a calcium borogluconate as a subcutaneous thing, there won't be any untoward reaction. You can give it very safely. So this is how you can manage acidosis with the hypocalcemia in the field level conditions very easily. So in field level conditions, you can get confused with the milk fever and acidosis. As I told previously, in acidosis, fluid splashing sound will be there. Dung will be semi-solid in nature. In milk fever, dung will be solid in nature. There is no fluid splashing sound. You can differentiate very clearly. If it is a milk fever, you give calcium borogluconate alone. If it is a case of acidosis, you treat it with the sodium bicarbonate with the normal saline and the fluid therapy that you can give. Sometimes combined acidosis and milk fever will be there. In such a cases, first correct the ruminal acidosis, followed by after a few hours, you can give calcium. For safer side, as already told, you can give calcium subcutaneously. It won't harm the animal, so that the animal become excellent recovery will be noticed. It will recover from acidosis also, and also it will recover from milk fever also. Okay. So in case of sometimes you will be coming across acidosis with the frothy bloat will be there. Here you can able to see the distension of the left palmar fossa, and in such a time you cannot able to appreciate the fluid splashing sound. Whenever there is always a bloat, you always correlate with acidosis, and this type of stomach tube can be introduced for identification of a frothy bloat. Stomach tube intubation is very, very important. So after putting the stomach tube, you can take out the stomach tube and you can see the rumen content. See, you can see the rumen content. You can put it in the flow. So the rumen content will be like this. The rumen content will be small, frothy in nature. So how will you treat this type of cases? So for frothy bloat, you can give any one of the following. Liquid paraffin, you can give liquid paraffin or antacid with the silicon dimethicone. So many practitioners, they used to give silicon dimethicone as a 100 ml, 200 ml. That is not sufficient. You have to give 400 ml or 500 ml as a treatment schedule, or vegetable oils. Any one of the above should be used. So usually what I used to prescribe antacids with the silicon dimethicone 500 ml orally with the fluids ringer lactate and sodium bicarbonate IV with the normal saline. So the animal will become normal. For example, when animal is having frothy bloat with acidosis, you give sodium bicarbonate with the normal saline IV, fluid therapy as a ringer lactate or normal saline IV, and oral administration of antacid with the silicon dimethicone 500 ml. Excellent results will be noticed in case of frothy bloat with acidosis. And the sequelae of acidosis, what are all the sequelae of acidosis? I mean complication of acidosis. What are all the complications of acidosis? Ruminatitis will be there, hoof abnormalities will be there, caudal vena cava syndrome will be there. In later cases, in future, liver abscess can develop, polioencephalomalacia can develop after some time. Okay. In field conditions, you could have come across this type of clinical cases. Sudden bleeding from the nostrils will be there. The animal will die immediately. This is all the case of caudal vena cava syndrome. So sudden bleeding from the nostrils means you have to think about a few things like snake envenomation. You have to think about snake envenomation. So if it is animal is alive in nature, I mean alive, you can go for whole blood clotting time. 20 ml, 20 minutes whole blood clotting time can be seen. And I think another within 5 minutes I will end the session. Whole blood clotting time. If it is not clotted in 20 minutes, you can see it is a case of snake annunciation. If the blood is clotted within 20 minutes, it's not a case of snake annunciation. You think about caudal vena cava syndrome. Okay, so suddenly the animal will die in the farm or in the cattle shed with the bleeding from the nostrils and the oral cavity. You have to think about. So you have to think about anthrax also. So differential diagnosis includes. But most of the time you will be getting this type of things. In live animals, alive animals, you can easily diagnose the caudal vena cava syndrome by means of ultrasonography. So normally in ultrasonography, the caudal vena cava appears as a triangular in cross section. But in cattle, the thrombosis, when it is having caudal vena cava in thrombosis conditions, the diagnostic aid, the ultrasonography, the caudal vena cava appears as oval or circular in shape in ultrasonography. There is no property, there is no treatment for caudal vena cava syndrome. So just for your awareness, I'm telling these are the complications of acidosis. So in polyoencephalitis Malaysia, sometimes after recovering from acidosis, you will be coming across some cases like that after a few days. After a few days, there will be staggering gait, incoordination, nystagmus, animal cannot able to stand normally. In such a cases, you can supplement thiamine. Supplement thiamine 40 mg per kg body weight, either intramuscular or intravenously, so that you can excellent result can be noticed. So always, whenever they are treating a case of acidosis, followed by neurological signs in few days, you think about polyoencephalitis Malaysia. Okay. So then frequently asked questions are there. Some of the questions I will share. Can I use dextrose solutions in ruminal acidosis? No, you should not use any type of dextrose solution. DNS, D20, D5. You should not use any type of dextrose solutions in case of ruminal acidosis. Okay. Can we use ringer lactate as a fluid therapy? Yes, we can use ringer lactate as a fluid therapy for correcting the dehydration. What type of fluids is needed to mix sodium bicarbonate? We have to use only normal saline. Okay. Can we give calcium in case of acidosis? After correcting the acidosis and after 6 hours interval, can give calcium subcutaneous or with normal saline effectively according to the signs of hypocalcemia. Safer side, as already told, you can give it as a subcutaneous or you can mix it with normal saline and give IV. Okay. So for example, now we are seeing this case. The animal is rumination is there, everything is normal. Can you say this animal is having acidosis? It's rumination. Rumination is there, so it's not having acidosis. It's a case. It's a normal case. So for recap, 3 things you have to keep it in mind: fluid splashing sound in the rumen, diarrhea, dull and depressed or sleepy behavior. You think about acidosis and treat it with sodium bicarbonate. Mix it with normal saline and give IV. Thumb rule: 1 ml per kg body weight for mild cases. For severe cases, 2 to 3 ml per kg body weight. Correct the dehydration by means of fluid therapy. Give oral antacids. That will be more sufficient for correcting the dehydration and acidosis, and the excellent result you can accept. And I think I have given a comprehensive knowledge regarding the ruminal acidosis. And thank you very much for your patient hearing. And I have concentrated only the clinical management of acidosis alone. I hope this webinar will be useful for your clinical practice. Thank you very much.
Thank you very much, sir, for your excellent and knowledge enriching session. The entire chat box is full for appreciation. Apart from that, sir, from my point of view and as per the participant, everybody liked the differential diagnosis part and the case study which you have presented and some of the commonly asked questions. There are only few questions, sir, because you are during the presentation only you have answered all the questions. There are few questions that I will display it to you, sir. Can I read it for you, sir?
Yeah. So what to do to increase fiber digestion? Prabhakar Kumar. Fiber digestion. So naturally, fiber digestion means probiotics is enough. Probiotics, supplementation of probiotics is enough. So normally there will be a balance of grain feeding and fiber feeding should be there in case of ruminants, so that the animal should chew the fibers and take it to masticate and it has to consume, so that salivary secretion will be there. Once the salivary secretion is there, the root acts as a rumen buffer. So 2 points are there. One thing, it will increase the acetic acid secretions. I mean, production will be increased, so that milk fat will be increased. So probiotic supplementation will be enough, and also split the concentrate feeding so that it will be okay. How histamine release gets increased in acidosis and lead to laminitis? Yes, histamine naturally during this, I told in the pathogenesis, in the lactic acid accumulation, the rumen pH drops. Once the rumen pH drops, there will be increase in the rumen osmolality. It draws fluid from the systemic circulation into the rumen, thereby the rumen that's having fluid accumulation is there. And because of the accumulation of rumen lactic acid and the drop in the pH, naturally the histamine release will be there from the rumen, and it will be absorbed from the rumen, and it will enter into the systemic circulation, and it goes to the peripheral circulation, and the vascular constriction occurs in the lamina propria, and that's why it causes laminitis. And laminitis is a subjective matter. You cannot able to assess clinically. It's a subjective matter. That's why laminitis occurs, and also hoof abnormalities occurs in case of subacute ruminal acidosis. How ruminal parakeratosis is related to ruminal acidosis? Very good question. Frequent drop in ruminal pH will lead to eroding of rumen villi. So the rumen villi will be eroded, and parakeratosis will be occur. Ruminitis will occur. Chemical ruminitis will occur. For that only sequelae, because of lack of time, I have not included that also. The sequelae of acidosis is the liver abscess will be there. For example, you would have come across some cases in the field conditions. The animal is not taking feed, not passing dung, and you will be treating the animal for foreign body syndrome or peritonitis like that. So you will be treating on, but the animal won't respond to your treatment. One fine day it will die. In the post-mortem, you could have seen liver abscess will be there. Why? How liver abscess occurs? Because of this ruminal parakeratosis or ruminitis. The organisms, the bacteria, they will get into the circulation, and they will get lodged in the liver, and they will form the abscess in the liver. They are the sequelae of ruminal acidosis. Okay. So because of the rumen reduction in the pH, this parakeratosis occurs. So one of the common sequelae of ruminal acidosis, ruminal abscess is also one of the rumors. Quantity of sodium bicarbonate administered IV and how it is calculated, how much fluid. Yeah, already I have explained in detail. The thumb rule 1 ml per kg body weight for mild case. Severe cases 2 to 3 ml per kg body weight. You mix it with the normal saline, that's all. There is no quantity of the normal saline. There is no hard rule like 500 ml or 1 liter of normal saline you have to use like that. But especially in fluid therapy, it's better always for a large animal, for adult cattle, minimum you go for 5 liters of fluid therapy. 5 liters of fluid therapy means 5 liters of normal saline or ringer lactate you give it. And for 500 kg body weight means you give 2 ml per kg body weight. 1 liter of sodium bicarbonate, mix it with 1 or 2 sachets of normal saline, give IV. Excellent results will be there. So quantity of sodium bicarbonate already I have told you. You can calculate. Calculation 0.3 into base deficit into body weight. That in acidosis, how long what is I mentioned, sir? It's not visible. In acidosis, how long the animal will survive without treatment, sir? It's not like that. How long means unless otherwise you treat it. If it is a severe case, it will die immediately. Okay. Only if it is a case of subacute ruminal acidosis, it will cope up normally and it will come back to normal normally. Otherwise, in acute acidosis case, and if you are not treating the case, it will die. Okay. What may be the treatment of severe acidosis instead of sodium bicarbonate? So in severe acidosis case, sodium bicarbonate should be mixed with normal saline and give IV, followed by fluid therapy, either normal saline or ringer lactate as a fluid therapy. What I used to do in large animal, in cattle, I used to give minimum 5 liters of fluid therapy. Excellent result, wonderful result will be that. Next, the animal will become in the standing posture. Recommend animal will be in the standing posture. Once you go for the fluid therapy, massive aggressive fluid therapy, you can see the lot of difference in the ruminal acidosis cases. Excellent results will be there. How much protozoa per field should be there present for normal rumen flora? Normal rumen flora, 1 plus means more than 10, 2 plus means more than 20, 3 plus means more than 30. Like that, you can be able to classify. When you are coming across very few protozoa only 2 or 3 protozoa, it's also a case of acidosis. Okay. Normal rumen flora means more than 20 should be there in the field. How to differentiate the acidosis and the paralytic ileus? In paralytic ileus, the history is very clear. The animal is not passing dung. Here, the animal is passing semi-solid dung. In paralytic ileus, there is no fluids passing sound. In acidosis, there is fluids passing sound. When you collect the rumen liquor, you can able to easily see the rumen protozoa is completely absent in case of acidosis. Paralytic ileus means complete absence of that. Okay, that's what should be the diameter of pipe of goat and so. For example, for cattle, half inch pipe diameter, half-inch diameter. Okay. For goat and all, you can use a small garden hose pipe that you can be using. Small tube, garden hose pipe or gas cylinder tube. I have shown in the pictures that you can use. Some other questions are there. What is the role of ringer lactate in treating ruminal acidosis? Though oral is also an acid. Yes, very good question. It's a long-term question. Everyone used to ask why ringer lactate. Many of us will be thinking ringer lactate is contraindicated in case of ruminal acidosis, like that. The main thing is that ringer lactate will be converted into bicarbonate in the liver and it will be assimilated into the body as a bicarbonate. That is a normal routine process of the mechanism. Okay. For example, when the animal is having diarrhea, you are administering ringer lactate. The ringer lactate is converted into bicarbonate in the liver and it is absorbed by the body system. But here in ruminal acidosis, the rumen buffer, there is a need of sodium bicarbonate buffer in a large quantity. This ringer lactate cannot able to convert in case of bicarbonate. This bicarbonate is not at all sufficient for catering the need of the buffer. So what we have to use here, the need is sodium bicarbonate. The sodium bicarbonate is the buffer to maintain the pH. So what we have to use, the sodium bicarbonate with the normal saline and give IV. And the correction of acidosis is only by sodium bicarbonate with the normal saline. Sodium bicarbonate. Here the role of ringer lactate is just a fluid therapy. That's all. Just a mere the fluid therapy. You can use normal saline or ringer lactate. It does not going to harm anyway. Since it contains balanced electrolytes, it does not go for any thing of acid at all. It's very safe. Can use it. Okay. So you said 5% of sodium bicarbonate use orally. No, not to use orally. It's for IV. 5% sodium bicarbonate is for IV. IV use. Okay. So dextrose or any, why not use dextrose? Yeah, I have seen many veterinarians still they used to use dextrose. Don't use dextrose or DNS or D20 or anything. It will aggravate the condition. So it will aggravate the condition. You do not use any form of dextrose solutions in case of ruminal acidosis. You keep away the dextrose solutions. Okay. In diet, more quantity of brinjal, tomato can cause acidosis. Yes, as it will cause acidosis. Specific dose of B-Plex 4 is 10 ml intramuscular, 10 to 15 ml intramuscular. Sir, is there any hyperkalemia in severe acidosis case that should be corrected with the calcium borocliconate? Is there hyperkalemia? Hyperkalemia. Okay, hyperkalemia in severe acidosis cases. In severe acidosis cases means when you are using sodium bicarbonate, naturally the hyperkalemia will be collected. So the treatment for hyperkalemia is sodium bicarbonate. Okay. So when you give sodium bicarbonate, the hyperkalemia will be corrected. So in small animals, in dogs and all, for treating hyperkalemia, we used to give sodium bicarbonate only. That's why I'm telling, when you give excess sodium bicarbonate, hypokalemia occurs, not hyperkalemia. Hypokalemia occurs. So you will be giving potassium chloride orally. So trocaran cannula can be used. There is no need of using trocaran cannula in case of acidosis cases, because whenever there is a frothy bloat, when you are putting trocaran cannula, it won't liberate the gas. Only the thing you have to drench orally the silicon dimethicone preparations with antacid solution. It will break the bubbles and it will release the gas from the frothy bloat. So no need of putting the trocaran cannula in case of frothy bloat. So many of us asked the PowerPoint presentation. I will give it to Santosh Shah, and he will be sharing the PowerPoint presentation to you. Kindly show the photos of dungs in different conditions. I will be sharing the PowerPoint to you, sir. Dr. Anil has asked the different type of dunks. I will be sharing the PowerPoint to you through Santosh. Which is the best sodium bicarbonate, 1.7, 1.3 or 7.5%? 7.5% is okay. 7.5% what we are getting in the commercial market is okay. So need not bother about 1.3% or anything. Just what is present in the available in the market is 7.5%. You get it and mix it with normal and give IV. 2 ml per kg body weight. Okay, that's at least 2 to 3 ml. If you are giving in a severe cases, it is more than sufficient. So after calculation of how much ml of sodium bicarbonate to be given, what percentage of sodium bicarbonate, I already told the same thing. There is no hard rule in mixing the normal saline. Just in 1 or 2 sachets, you can mix it and give it. Yeah, one good question. One time administration of sodium bicarbonate with NS is sufficient, sir. Vinodha asked. So this is another point I want to insist that many of the practitioners, when you are attending a case of acidosis today, you are giving a sodium bicarbonate with normal saline, fluid therapy, everything. The next day, the farmer will be telling the animal is not taking feed and all. We have to ask whether there is improvement in the clinical science from yesterday and today, comparing to yesterday, today, whether there is an increase. For example, the animals, the lateral recurrency coming to sternal recurrency. A sternal recurrency is standing posture. There is improvement in the cases. So you need not repeat the sodium bicarbonate. You will repeat the fluid therapy. You repeat the fluid therapy cases and such cases and give probiotics, oral antacids, and B-complex supplementation. That will be sufficient. You need not repeat the sodium bicarbonate daily. Okay. Pantoprazole can be used in case of ruminal. There is no rule of pantoprazole in case of ruminal acidosis. In case of ruminal acidosis, it can be used in case of abomasal ulcers. For case of abomasal ulcers, you can use pantoprazole, not in case of ruminal. Onion leaves, that's an entirely different thing. That's not lead to acidosis. That's a separate thing. Onion leaves that will lead to hemorrhagic enteritis. That you can treat it symptomatically with the fluid therapy. Fluid of choice in case of alkaline indigestion. It's a very good question. Normal saline. You can give normal saline. And in alkaline indigestion, you have to give orally vinegar. Acetic acid can be given 3 to 5 liters orally. For example, putrefied rumen content, pH alkaline nature. That is entirely different one. You have to drink it. Acetic acid. Okay. Somebody of mechanism how dextrose aggravates. I mean, there is no need of placement of any need of dextrose here. Already the animal is having increase in the lactic acid accumulation and volatile fatty acids are increased. And the dextrose condition here, there is no role of dextrose in this condition. I mean, the ruminal acidosis, D20 or DNS or D5. So when you are giving dextrose solutions, it will aggravate the condition. It will worsen the condition by clinical science will worsen. That's why I'm telling there is no indication of using dextrose, normal saline, or dextrose solution in case of acidosis. It's like asking whether in case of calcium borogluconate, when you are giving, instead of giving the rational treatment of calcium, if you are giving dextrose, it will correct or not, like that's the question. So you should not use dextrose in case of acidosis. Cut dropping is a sign of acidosis. Cut dropping won't be there. Rumen regurgitation may be there in case of acidosis. Cut dropping could be seen in case of listeriosis. Listeriosis, it will be there. Why food is withheld for 24 hours? Not food is withheld for, animal, already the animal is anorectic. Animal is anorectic. The animal will have only thirst. It will go for thirst and it will go and engorge with more amount of water. So restriction of water intake only will be avoided. Once if the animal is started taking feed, it can take feed, no problem. You need not restrict the animal for taking feed at all. Only the thing, restrict the grain feeding. Don't give the grain feeding. Give the good quality of roughage or hay like that. How to use home available sodium bicarbonate, Dr. Sanjay Kumar. 5% solution, 5 gram in 1 liter of normal saline. If you are not able to exactly take care about 5 gram of 1 liter, 5% solution, you have to take care. You should not give excess sodium bicarbonate powder in normal saline. You have to take care. That will lead to hypokalemia. I hope I have answered all the questions. I think.
Yes, sir. Most of the question has been answered, sir. Thank you very much for your question and answer session, sir. Making it very interactive and taking some live questions also from the participant. Sir, the flag went end of the session. If you permit, we proceed, sir. With vote of thanks. So should we proceed with this vote of thanks or some question or take, sir? So warm and graceful evening to Honorable Dr.S.Sivaraman, sir. It is my privilege to propose vote of thanks speech and acknowledge the contribution of those who work really hard to make this webinar successful. On behalf of all the participating veterinarians and Alembic Pharmaceuticals Ltd, myself, Dr. Santosh Shinde, express my sincere gratitude to Dr. S. Sivaraman, sir, for such an informative, applied presentation with the differential diagnosis and case study. Sir, your presentation will definitely help all the participating veterinarians, students, and field veterinarians for their day-to-day practice. So they can assess, they can treat the cases of ruminal acidosis, differential diagnosis. As you are taking some of the case studies, sir, most of the participant has given the correct answer. The first case, you asked the question, most of the answer which comes in the chat box was correct. So whatever the presentation you have given, and sir, one more thing I have seen, we conducted so many webinars. Last year we conducted 67 webinars. The first time I've seen the consistent participant. There was never drop in the participant count, sir. It was consistent, more than 1.5 hours participate or consistent. So that is the impact of your presentation, sir. Nobody wanted to leave the session. They are eager to say that what next sir is going to speak about, and you can see all the chat boxes filled with the appreciation only. Sir, in future also we would like to take the benefit of such interesting and informative session, so we can serve the society. My special thanks goes to Dr. Meera P. Sakare. Presently, she is assistant professor who was permanent in Department of Preventive Veterinary Medicine. For all type of ECB webinar of Alembic, arranging the webinar, suggesting the topic, suggesting the speaker also, and not only for the Alembic CVE, most of the societies, which for the you can say organization or for the livestock sector or maybe seafood sector, whenever any webinar is there, she is aggressively participating that, contributing, so that there will be discussion used to take place with which speaker we should take it, what is the benefit, which topic we should select. For that purpose, from Alembic Pharmaceutical and from all the participants, we thank Dr. Meera P. Sakare. Last but not least, I wanted to thank all the participating veterinarians from India and abroad for participating in this webinar, taking time out and participating in this webinar. Also thank Mr. P. Karunanidhi, Senior Vice President Alembic, for his continuous motivation, guidance, and support to organize such type of webinar for the benefit of field veterinarian as well as student and researcher. Also, I like to thank Mr. R.K. Sharma, who is sales head of the Alembic Pharmaceutical and entire field force of Alembic, for calling the doctor, inviting the doctor for the webinar, so that they will enrich with the what are the recent update in the treatment of acidosis. I also like to thank my entire Alembic team, Dr. Amit, Dr. Naresh, Sanjay, for continuous support and arranging all the things, and everything will be on place so that we can successfully conduct the webinar without any technical hitches. Last, once again, I wanted to thank Honorable S. Sivaraman, sir, for such an excellent presentation, and all the participating veterinarian. On the behalf of all the participants and Sivaraman, sir, we say that Happy World Veterinary Day in advance. Thank you.
Thank you. Thank you very much, sir. Thank you very much, Alembic Pharmaceuticals, for arranging a webinar on the year of World Veterinarians Day. And I would like to congratulate all the practicing veterinarians. Very happy World Veterinarians Day. And let's practice with the dedication and sincerity. Thank you very much.
Thank you.